We're live.
Hi, I'm Brett Christopherson with USA Today Network Wisconsin, and this is today's Coronavirus 5 and 5, a 5-minute rundown of 5 of the top stories by our network of journalists who continue to report on the COVID-19 pandemic. We'll lead it off with the numbers and this headline: Wisconsin's new coronavirus cases dropped below 200 for the first time in May. For the first time, actually, since April 27th, Wisconsin's newly confirmed cases of the coronavirus were fewer than 200. Daily updates of positive tests had averaged 336 in May before Monday, when state health officials announced 199 positives among nearly 3,100 tests. Total confirmed cases in the state are at 10,418, according to the Wisconsin Department of Health Services. Total deaths in Wisconsin due to COVID 19 increased by 9 to 409. Matt Piper writes in his story that the number of test results revealed was the lowest in a week, but even so, there was encouraging news in the portion of tests that came back positive for the virus. Just 6.5% of results announced Monday were positive, the second lowest number since the state changed its reporting on March 30th to exclude repeated tests of the same patients. According to the Wisconsin Hospital Association, there were 340 patients hospitalized with COVID 19 as of Monday morning and 179 inpatients awaiting test results. Our next headline is this: new research says hotter weather can slow spread of coronavirus, but it won't wipe it out. Health and science reporter Madeline Heim writes that new research led by Harvard University predicts that hotter, more humid weather may help, but it won't reduce transmission of COVID 19 entirely. And of course, Wisconsin is projected to have a cool summer ahead. Researchers found that when all other factors are held constant, hotter and more humid weather, as well as other factors like precipitation, could create a modest decrease in that reproductive number, which could help control transmission of the coronavirus. But they also found only a few locations where reproduction of the virus would be cut in half during even the most hottest and humid seasons, leading researchers to suggest that changing weather conditions alone will not be able to fully contain the spread. You can find Madeline's entire story online. Moving on to this headline: you can now get a coronavirus antibody test in Wisconsin, but experts warn results won't live up to high expectations. Even though the antibody tests are now available in Wisconsin, public health experts are voicing caution about just how useful they will be for those who are tested. If not executed correctly, the test, I should say, can yield more false positives than true results, painting an inaccurate picture of who's had the virus. Madeline Heim is also the reporter for this story, and she writes that even with an accurate test, there's still no certainty about whether someone who's had the virus is now immune and able to safely return to work or other public activities. Read more online. Next, Wisconsin Air National Guard jets will roar over cities to salute healthcare workers. Wisconsin Air National Guard pilots and F 16s will fly over different cities of the state on Tuesday to salute healthcare workers and first responders on the front lines of the coronavirus pandemic. Pilots from the 115th Fighter Wing, based in Madison, will participate in Operation American Resolve, a national campaign to show appreciation to folks battling COVID 19 and everyone supporting them. Some of the 115th Fighter Wing pilots, by the way, that will be flying on Tuesday, are married to people who are working in healthcare. The Journal Sentinel's Meg Jones lists the flyover schedule, which includes the cities and times, in her story, which you can also find online. And we'll close today's 5 and 5 with this headline: as grim stories emerge from Wisconsin nursing homes, one took steps to halt the coronavirus and keep everyone safe. The Journal Sentinel's Rory Linnane profiles Autumn Oaks Assisted Living in Washington County, which has demonstrated a rare trajectory. Once facing 4 active cases of coronavirus, the staff took aggressive measures to test, separate, and protect residents and themselves. And by doing so, it appears that they've stopped the virus, at least for now. County health officials said actions taken at Autumn Oaks could be replicated elsewhere with the right public oversight and support. At least 40% of all Wisconsin residents who've died with COVID 19 were living in long term care facilities, according to May 8th data from the State Department of Health Services. Read more of those stories and find our complete lineup of coronavirus coverage on any of our 10 USA Today Network Wisconsin websites and jsonline.com. Two more items to get to before we wrap it up. First, look for a special coronavirus edition of our Newsmaker show on Wednesday at 4 o'clock. USA Today Network Wisconsin health and science reporter Madeline Heim will be talking with UW-Madison epidemiologist Malia Jones about a group she started with a few other women with PhDs in public health to explain the nuts and bolts of the coronavirus pandemic. The show can be seen on all our network all our network websites and Facebook pages, and you can also ask questions through either of our real-time chat or the comments section on Facebook. And finally, please sign up for a digital subscription to any USA Today Network Wisconsin website. It's just $39 for the first year and gives you full access on any device, mobile, desktop, and tablet to all our local stories, photos, and videos, plus news and sports from around the state. If you want the most complete, most in depth coverage of what's going on in your community and throughout Wisconsin, we've got it for you. Go to any of our USA Today Network Wisconsin websites and click on the subscribe tab at the top right of the site. Please support local journalism. That's it for now. And as always, be safe.